Good evening. The National Advisory Committee on Immunization, or NACI, is recommending that more Canadians get a COVID-19 booster shot.
In fact, NACI is now strongly recommending everyone over 50 get one and is opening the door for some younger people to get the booster as well. The new recommendations come as Canada announces new testing measures for air travelers amid the spread of the new Omicron variant. Ingram is following the day's developments and much more. He joins us in studio with more.
Phil, Health Canada says there are 11 declared cases of the Omicron variant in this country, with 6 of them right here in Ontario. This afternoon, York Region declared its first case, a child under the age of 12 who recently traveled to Africa. Just yesterday, Halton Region announced 1 confirmed case of Omicron and 2 probable cases. And in Hamilton, Public Health says it's still waiting for results in 2 potential cases. To slow the spread of this new variant, the government announced more testing for international flights to try and catch the cases as they arrive. Alarmed by Omicron, the feds say people flying in from countries other than the U.S. will soon be tested on arrival, in addition to their pre-departure test.
All travelers should expect to be tested upon arrival and should be ready to isolate.
Health Minister Jean-Yves Duclos says the government is rolling out the program in the coming days, but it won't apply to the land borders. Travelers will be swabbed or get a take-home test and will have to isolate until the results are in. But the details of this new scheme are complicated, especially if you have a connecting flight.
It's quite complicated. I think we're going to have to put up some tools on the website.
Hamilton MP and new Minister of Procurement, Philomena Tassi, also announced Canada had signed deals with Pfizer and Merck to buy at least 1.5 million COVID antiviral pills. If you catch COVID, these drugs will help you heal.
As soon as these drugs are authorized for use, the government will work on getting them to provinces and territories as quickly as possible.
The announcements come as NACI calls for more people to get booster shots.
Vaccine effectiveness against infection and symptomatic disease decreases with time.
NACI is strongly recommending anyone aged 50 and older to get an mRNA booster shot 6 months after getting their second shot. Ontario already expanded booster eligibility to that age group earlier this week. It's also recommending boosters for seniors in congregate living, anyone who got 2 shots of AstraZeneca, as well as frontline healthcare workers and First Nations communities.
Not only because they were at higher risk, potentially for serious outcomes, but that they were immunized earlier.
NACI says the very rare risk of myocarditis, which has been associated with vaccination, is actually less after the 3rd shot.
It does seem to be substantially lower than the second dose, which is great news.
NACI is also recommending boosters may be given to people in the 18 to 49 age group, depending on their risk factors, like risk of transmission and serious illness. But the number of young and potentially healthy people who could qualify could be large, requiring much more vaccine. And that's raising questions for the chair of the Black Scientists Task Force on Vaccine Equity.
And we're going to get mutations as long as we allow countries or regions to be incubators for mutations.
Akwatu Kenti says 35 African nations have less than 1% of the population vaccinated, and a few don't have anyone vaccinated. He thinks Western countries should send more vaccine to the region, noting Canada has only fulfilled 8% of its 40 million dose commitment to low-income countries.
We have doubly the amount of vaccines that we require for our entire population stored, and more on the way that's been ordered.
The World Health Organization says Omicron has now been detected in 38 countries. That's up from 23 2 days ago. The organization says early data shows the strain is more contagious.